Hello, everyone. My name is Angela Davis. Today, I'll be presenting Advancing Hospice Care Through Interdisciplinary Communication and Documentation. This presentation is prepared for the Department of Nursing at Rowan University, course NURS 05507, Leadership and Care Delivery Environment, under the guidance of Dr. Kelly K. Beach. Hospice organizations face significant challenges in maintaining consistent interdisciplinary communication and accurate documentation, which are essential for patient-centered care and regulatory compliance. Current practices often result in fragmented information exchange among nurses, physicians, social workers, and chaplains, leading to delays in updating care plans, gaps in coordination, and discrepancies between verbal discussions and written records. These inconsistencies jeopardize compliance with the Centers for Medicare and Medicaid Services, conditions of participation, increase the risk of survey deficiencies, and undermine trust among patients, families, and staff. Without a structured approach to align communication with documentation, hospice teams struggle to demonstrate medical necessity, ensure timely interventions, and sustain organizational integrity. One of the biggest challenges we face in hospice care is when communication and documentation don't line up across disciplines. That inconsistency doesn't just create paperwork problems. It leads to care gaps, increases compliance risk, and erodes trust among patients, families, and staff. That's why this improvement plan focuses on aligning communication with documentation to close those gaps. To address these gaps, 4 key strategies are proposed. First, standardized electronic health record templates will ensure every discipline documents consistently and aligns with IDG discussions. Second, a clear workflow protocol supported by a scribe or digital tool will make sure notes are entered within 24 hours, closing the gap between conversation and documentation. Third, staff training will reinforce compliance expectations while also building collaboration and confidence across the team. Finally, quarterly audits will serve as feedback loops. Together, these strategies create a structured pathway that strengthens timeliness, accuracy, and reliability in hospice documentation. Communication drives everything in hospice care. Fragmented talk leads to weak documentation, which leads to compliance risks. Strong communication makes for clear notes and creates trust and safer care. When team members don't share information consistently across disciplines, patients experience gaps in care planning. Critical updates may be missed, leading to fragmented interventions and unmet needs. Late or incomplete documentation creates vulnerabilities during regulatory surveys. If care plans aren't updated properly, auditors may find discrepancies that put compliance at risk. What's discussed in IDG meetings doesn't always match what's recorded in the chart. This misalignment undermines continuity of care and makes it difficult to demonstrate medical necessity. These gaps directly translate into deficiencies under CMS conditions of participation. Inconsistent records weaken the organization's ability to prove coordinated, patient-centered care was delivered. Ultimately, families, staff, and regulators lose confidence when communication and documentation don't align. Trust is the foundation of hospice care, and it suffers when processes break down. Communication drives documentation. Documentation drives compliance, and compliance drives trust. So the flow of this chain reaction is simple. Strong communication leads to accurate documentation, which strengthens compliance and preserves organizational trust. Measurable objectives have been set to ensure accountability. The aim is for documentation to be completed faster, stronger alignment between verbal and written records, improved staff satisfaction, and fewer compliance deficiencies. These metrics give us a clear way to track progress and demonstrate impact to regulators, staff, and patients. These numbers matter because behind every audit finding is a patient or staff experience. Families notice when documentation lags, and staff feel more confident when communication is structured. That's why this project isn't just about compliance, it's about people. Our measurable objectives give us the numbers, but the expected outcomes show the impact. Timely documentation means patients receive care without delay. Higher concordance means families can trust that every discipline is aligned. Improved staff satisfaction fosters collaboration, and fewer compliance deficiencies strengthen organizational integrity. Together, these outcomes advance patient-centered, sustainable hospice care. This project is scoped to interdisciplinary group meetings and electronic health record documentation, ensuring feasibility and alignment with compliance requirements. It involves the core interdisciplinary team, including nurses, physicians, social workers, and chaplains, while excluding billing and non-clinical reporting to keep the focus on care planning. This diagram shows how the plan flows in practice and how each step builds toward improved documentation and compliance. We start with standardized templates, move into clear workflows, reinforce with staff training, and validate through quarterly audits. Together, these steps lead to the outcomes we're aiming for: timeliness, accuracy, and reliability. This slide demonstrates the project's scope and logistics. 4 core interventions implemented over 6 months with minimal financial impact and quarterly checkpoints. Training is a key part of this improvement plan. Brief quarterly sessions are built right into existing staff meetings so they don't add extra burden. These sessions focus on updated workflow responsibilities, compliance expectations, and reinforcing collaboration across disciplines. Staff will also receive practical tools like short modules, checklists, and reference guides. The goal is straightforward: clearer documentation, less duplication, and stronger teamwork that builds confidence in care planning. Quarterly audits are the backbone of accountability in this project. Using CMS compliant tools, we'll measure how closely verbal updates from IDG meetings align with written documentation in the electronic health record. The target is 85% across disciplines, which ensures care plans are consistent and reliable. These audits not only reduce compliance deficiencies, but also build trust by showing families and regulators that our documentation reflects real interdisciplinary collaboration. Results will be shared through dashboards and reports to keep both leadership and staff engaged in continuous improvement. Audits turn our strategies into measurable proof of compliance and trust. Protecting privacy, ensuring equitable care, and fostering psychological safety are the ethical foundations of sustainable, patient-centered hospice practice. Protecting patient privacy is non-negotiable. Documentation must safeguard protected health information, ensuring only authorized team members have access to sensitive information. This reinforces both regulatory compliance and patient trust. Every patient deserves consistent, patient-centered documentation that reflects their goals and preferences. Standardized processes reduce bias and ensure equitable care across diverse backgrounds. Staff need to feel safe to speak up, share concerns, and collaborate openly. Structured communication and transparent reporting foster psychological safety, which strengthens teamwork and reduces patient safety risks. The communication strategy shows how we'll sustain these improvements. Structured IDG meetings keep discussions consistent, dashboards make progress visible, and feedback loops ensure staff voices are heard. Together, these elements embed the intervention into daily practice and create transparency, accountability, and psychological safety. Regular IDG meetings with standardized agendas keep discussions consistent and aligned with documentation. Dashboards and reports make progress visible to both leadership and frontline staff. Training doubles as education and communication, reinforcing compliance and ethics. Transparent reporting builds trust, while feedback loops ensure staff feel safe to raise concerns and suggest improvements. Having outlined the project scope and strategies, the next focus is the supporting evidence and its demonstrated impact on hospice care. Research shows fragmented communication leads directly to survey deficiencies. That's why standardization matters. Collaboration across disciplines is proven to improve continuity of care. Psychological safety isn't just a buzzword, it's linked to better documentation and patient safety. Families trust providers more when communication is clear and consistent. In closing, this project demonstrates that by bridging communication and documentation, we strengthen compliance, build trust, and advance patient-centered care. The strategies outlined are sustainable, evidence-based, and achievable with minimal financial impact. Ultimately, this isn't just about meeting regulatory requirements. It's about ensuring that every patient and family experiences hospice care that is coordinated, compassionate, and trustworthy. Thank you for taking the time to listen to my presentation.